Now, a study released this week suggests that banning alcohol could be a sensible policy to help South Africa through health crises. During COVID-19 lockdowns, you'll recall at various times the sale and transport of alcohol in South Africa has been completely off limits. At other times, sales have been restricted to certain days and times. Now, this study suggesting that only complete prohibition appears to free up medical resources, partial restrictions do not. To discuss, we're joined by Dr. Kathryn Chu from Stellenbosch University. Doctor, thank you for being with us. Is this interesting to you as a medical professional? Is it surprising in any way?
Yeah, thanks, Francis. I think that the results that complete alcohol bans significantly reduced trauma, but partial bans did not, was surprising, because we possibly would have thought that having some limitations would slow the rate of trauma admissions and operations, but unfortunately it didn't.
So, and this was comprehensive enough to check whether changing the curfew times, I think we could buy alcohol until a Thursday, but not over the weekend. So is it conclusive that none of those things seem to make a difference at all?
Well, this was only a single hospital in the Western Cape, so I think that perhaps if we had larger numbers, we might be able to tease that out. But our study showed that partial alcohol bans didn't make a significant difference. It seemed to reduce the absolute numbers, but statistically, it was only the complete alcohol ban that made a difference.
Yeah.
And obviously, this does have public health and policy implications.
Before everybody gets completely alarmed, this is about a temporary ban, correct? When there is a health crisis, when there is huge strain on hospital resources, it's not saying that it would be a good idea for South Africa to ban alcohol completely.
Certainly. I'm a surgeon and a researcher. I'm not a policymaker. So all we can say is that during the COVID lockdown, when we wanted to reduce emergency room and hospital admissions, the times that the government declared a complete alcohol ban was highly effective in reducing the trauma burden at the hospitals. Yeah. And this in turn, of course, decreased overall activity, because in South Africa, up to 40% of emergency room admissions are related to alcohol in injury. So by reducing the trauma burden, you reduce the overall traffic in the hospital.
Yeah.
And certainly what we did see, though, is each time the ban was lifted within 24 hours, the volumes did go up, even during the times when there was partial sales allowed and partially banned. So we're not saying that the alcohol industry should ban alcohol or the government should ban alcohol completely, but certainly if you have a national emergency such as a pandemic and you need to quickly reduce the traffic in hospitals, alcohol bans are very effective.
Yeah. I'm just trying to understand, and excuse the simplistic questions, but could we tell why? If there's a curfew and people are not allowed to go out and carouse and get involved in fights, why were so many people still coming through the doors? Does it seem like they were just ignoring the curfew? Was it possible to tell?
No, so this study didn't have the level of detail or the granularity to show that. But certainly when alcohol is partially allowed, even from Monday to Thursday, for example, people can take the alcohol home and then drink. And then if they get into trouble there, they're still brought in as an emergency, because emergency services were still happening. So I do think that allowing some access to alcohol during the lockdown can still result in some trauma volume.
Yeah.
That's significant.
All right, and you say you can't make policy choices. You are looking at this from a health perspective. It's always a debate. Alcohol can be abused, but it's a legal substance, and people have freedom to choose their health choices generally. Would you give your opinion? Is it fair enough to curb some freedoms for health reasons?
Well, I think that during a national emergency such as the unprecedented one we had, temporary complete bans certainly were effective. But I think in the longer term, alcohol-induced injury is a big problem in South Africa. And if we ever to have a more prolonged emergency like the one we did, where we want to reduce traffic, and we want to look at other ways that partial alcohol bans or other policies like a reduced trauma that might be effective. So just limiting sales didn't seem to be effective, but perhaps limiting advertising for alcohol during a national emergency may be helpful. Reducing the size of alcohol bottles that can be purchased, so limiting the size of the bottle that can be purchased also might be helpful.
Yeah, various options. And finally, has temporary been defined as a time limit? Do we know when sort of the benefits kick in? Of course, some people can stock up for weeks and months ahead, but most South Africans can't.
Yeah, so the first complete alcohol ban lasted more than 2 months, and we didn't see an increase over time, meaning that people were sourcing, the general majority of people were sourcing alcohol in other ways. Obviously, we know that alcohol can be obtained illegally. And then the second complete alcohol ban was shorter. But again, as soon as that was lifted, even with the partial sales, the trauma volumes increased almost back to normal. So we do know that temporary bans are effective. But to answer your question, I don't know about the time frame.
All right, well, a fascinating study. Thank you for explaining that to us. That was Dr. Kathryn Chu from Stellenbosch University.